Okay, we have another case submitted here for sites number 19 and number 30. This particular dentist is a CEREC owner, submitted CEREC design. His notes were that has some questions on his designs, what could be better, how could it be improved in terms of the CEREC virtual wax up. I'll make some comments there. And then he wants to evaluate number 30 and number 19. Number 30 has a minor defect and number 19 has a bigger defect. And then the patient will plan on doing implants in site number 3, 13, and 14 later. It's wonderful when you get into this game and patients start doing treatment and start doing implants step by step. It's a wonderful practice builder. So what I'd like to start with in this case is let's go ahead and look at this number 19. I really like the design here. As we look down the line, everything looks pretty good there. You know, if I were to be critical, I would maybe say that this crown could be maybe tilted a little bit to the lingual there. But when we look at it right here, the main thing that I'm looking at here is my gingival margins look pretty good right there, and right there. So that crown looks like it belongs. Now when we come to the other side, what I'm seeing here is something more along the lines of this. Now, what I would do is when I would draw this, I would actually draw this margin in the CEREC side of things. I would draw this margin more like right there. And that would look more along to be in the lines of what we're doing there. Again, minor things, doesn't make that big of a difference, but it's the little things that the attention to detail over time. So let's go ahead and start here in site number 30. I see exactly what we did here. Plan looks pretty reasonable. Our occlusal plane looks nice. We're dead center, pretty much dead center of the restoration itself. You know, 4 by 13 is certainly more than adequate for a molar site. You know, honestly, if we're going to do a little bit of grafting here on the buccal, we might as well go ahead and go to a 5.0 implant and do just a little bit more grafting. The other thing we can do is we can just bring that a little bit to the lingual and then tilt that back there, and that is probably a little bit more ideal there, and go ahead and bring that up just a hair. Now in this particular case, I would be very, very comfortable placing this implant and grafting at the time of placement. Little mini flap here, make that pretty easy. Another option, depending on the comfort level, is to do a pilot hole and then to use some ridge expanders like from BTI, some bone expanders to expand out the ridge. This will especially work in this buccal, the crestal buccal area there, to avoid doing any graft. But even if not, just a little bit of graft there is not that big of a deal. And also do remember that these implants generally have a smaller osteotomy than the 5.0 itself, so you'll be surprised how often that you might not even see any need for grafting there. So I would go ahead and plan this for a 5 by 13 implant and then do just a little bit of grafting at the time of placement. The nerve is no issue. In fact, if we wanted to, and there'd be absolutely no reason to, you could go to a 5 by 15. But 5 by 11 and a half is more than good enough. 5 by 13 is more than good enough here. So no problem there. Now let's go ahead and move to site number 19. And based on our plan, again, if we take a closer look at it, our occlusal plane looks pretty darn good. You know, maybe we could tilt it just a hair that way. It's no big deal there. But what I want to work on in this plan, and I haven't done this in advance, I'm doing this on the fly, is can we do this? Something about this doesn't look right to me. The resorption pattern just doesn't look right. So what I would probably consider here is let's go ahead and bring this into the center of the ridge, and then let's go ahead and tilt this like so. And now look at the distance away from the adjacent teeth. Let's go ahead and get that centered there, and then let's go ahead and tilt it just a little bit more there. And now suddenly we're looking at something that's a little more doable. Again, let's just go ahead and go for a 5.0 here. We may end up placing a 4.3, but let's plan for a 5.0. And then in this particular case, let's drop it down right there. Now in this case, everybody's going to be a little bit different, but I'd be pretty comfortable grafting this at the time of placement. You know, the areas that I would be worried about with the graft are right in here. Okay, but again, this would be another great use for some bone expanders, maybe to at least expand out the crestal third or crestal half of the osteotomy. Um, so this right here looks a little bit better compared to, if we compare to the original plan for site number 19. We can see how the majority of the implant is outside of the ridge, whereas right here the majority of the implant is inside the ridge. And then again, we can just add a little bit of bone right here at the time of placement. And again, that we may not even, again, we can see that there's some bone around the implant. So, this would be one of those game time decisions. But I would definitely go ahead and flap this back to make sure I have good visualization of everything that's going on there. So hopefully this was very helpful. Thank you for submitting, and have a great day.